Good morning. Today we'll be talking about arthritis, managing pain and keeping active. And with us today we have two specialists, a physician and a surgeon, to talk about the condition. Good morning, Dr. Ima. A pleasure to have you with us, and Dr. Tina. A pleasure to have you with us for the first time. Dr. Ima has come on the program several times in the past, but it's a pleasure to have both of you with us.
Thank you.
Thank you very much for having me.
Now, we're talking about arthritis. Dr. Ima, if I could just kick off with you. Can you just tell us, what is arthritis?
So I think first things first is to, first of all, deal with the myths that we tend to have with what we call arthritis. And there are a few myths, 2 or 3 I'll probably just right off the bat deal with. One of them is the fact that arthritis is not a diagnosis, the same way you have malaria as a diagnosis or have diabetes or hypertension. Arthritis is not a diagnosis. Arthritis is just a description of how people feel when their joints ache and sometimes are swollen and probably stiff. So having said, address that myth that we tend to have, the second myth, therefore, that follows from that is to say that arthritis is not one disease, it's not one diagnosis. There are many things that cause arthritis. A very good way of beginning to explain or describe this is headache. Headache is not a diagnosis per se, but there are different types of headaches. There are different things that cause headaches. A stroke can cause a headache. If you hit your head against the wall, it can cause a headache. If your blood sugar is low, you can have a headache. If you have your heart broken, you can have a headache. So there are different things that can cause a headache, but it doesn't mean they're all headaches, but there are different causes. So that's the second thing. So it's to now say that what exactly is the type of arthritis that one has, and there are different types of arthritis or causes of arthritis, between 100 to 200 as of the last count. I think
100 to 200. My goodness, that's a lot.
Yes.
That's a lot of causes of arthritis. Can you give us some of the common ones?
The most common one that we probably know that associated with age is osteoarthritis. That's the degenerative form of one of the degenerative forms of arthritis. There are other forms. Lumbar spondylosis is another form. Rheumatoid arthritis is one where we rheumatologists tend to see, and that's where our name was derived from. Lupus can cause arthritis, gout can cause arthritis, psoriatic arthritis. You even have the juvenile form that affects children and teenagers. So there are different causes of arthritis, even the spondyloarthritis. So there are quite a number of things that can cause pain in the joints. Yes.
So now we're talking about arthritis. And even can you describe the different kinds of arthritis? And Dr. Tina, if you want to also join in, if there's anything you want to add in, please join us. So what kind of arthritis or arthritises are there in terms of symptoms?
Okay.
So yes,
I was going to allow Dr. Tina to speak. Yes.
Okay. Yes. So thank you, Dr. Ima. So basically, let's just explain that wherever two bones articulate, that's where two bones meet, there's likelihood of degeneration. So two bones would meet at a joint. There are different kinds of joints in the body, but basically where you have two bones meeting, you call that point a joint. Every joint is prone to degeneration depending on how much movement is allowed in such joints. So for that reason, synovial joints, which have the most movement, tend to degenerate much more than, say, fibrous joints that don't move. So that's the beginning of the problem. The fact that there's movement, the fact that there's friction over time will cause wear and tear. So that's the basic lay reason behind arthritis. Now, when we pick the typical joints, say the commonest osteoarthritis will be osteoarthritis of the fingers. Then the other common ones will be the knee joints, the hip joints, and all that. So what is actually happening? What is happening will shed more light on what kind of symptoms. The surfaces of the bones that articulate to form a joint are typically in a synovial joint lined by hyaline cartilage. Now, cartilage is not the same as bone. It is the smooth, shiny, soft lining of the bones to reduce friction. And then in this same contraption called the joint, you have a capsule that is lined by membrane. The job of the membrane is to produce fluid. Now, when there is a loss of the normal components, so the fluid is reduced in quantity, there's increased friction, there is inflammation within the space, all this will lead to arthritis. And then it becomes a vicious cycle because there's swelling, there's stretching of the capsule. Over time, the capsule gets thickened, and then it results in stiffness. So the person typically will go from pain and then to stiffness, and then from stiffness to inability to move. And then you become sedentary. And then therein comes all sorts of problems that comes with a sedentary lifestyle, but it's all cascades from pain from arthritis. Are we getting some?
Yes, no, definitely. I think that we are. Dr. Ima, do you have anything you want to add to that?
Yes, I think she's done a very good job at explaining, the underlying anatomy, biology, as it were, of the joint, and that's where a lot of the arthritis. That's actually where arthritis takes place, really. Just to say that the cause of an arthritis could either be, I could grade them in three just for the appreciation of the layman. It could be localized to within to around the joint itself in terms of the cause of the arthritis. It could be not too far from the joint, and it could be something that is affecting the whole body. And if it's something that just localized to the joint, it could be anywhere from some form of a trauma or accident that's happened that now eventually leads to some form of arthritis, or it could be some form of infection that has infected a particular joint, or it could even be some other thing that's pain affecting some other surrounding tissue that seems to also be reflected in the joint. For instance, when you have soft tissue rheumatisms, where things like tendons, ligaments that are around the joint have pain, and then you feel them as though they were a true arthritis. Obviously, it's only a professional that will be able to differentiate between a true arthritis and a false arthritis. But essentially, they present in some form of a similar manner. Then it could also be affecting the entire body, where in that case is a systemic problem. Such things as rheumatoid arthritis that can be affecting multiple joints, lupus that could be affecting not just the joint but other organs, gout that can deposit crystals of gout in different parts of the body. So we could look at it in those three ways, and they could fall into any of these categories in terms of what might cause an arthritis.
Yes, I mean, not too long ago was World Lupus Day, so it's actually very appropriate that we're mentioning lupus at this juncture where we're talking about arthritis, and arthritis being a way that actually people could present that have lupus and other autoimmune conditions. But so what you're saying is that, if I get it right, from all that we've gathered from both yourself and Dr. Tina, we can either have it pain in one joint, pain in many joints, and the causes are different depending on what kind of pain we're talking about. So now we try to talk about arthritis in general now, because even though it comes up, I think maybe it might be useful just to talk a bit about how to separate them in terms of diagnosis. Does diagnosis matter in terms of treatment? Dr.
Yes,
Ima?
it does.
Oh, sorry, Tina.
Yes, it does matter. Having said that, the commonest kind of arthritis that will come my way will be the wear and tear, straightforward degeneration from aging. As surely as we'll grow gray, we will develop arthritis in one joint or another. It's just that it will be to different, extents for every individual. Yeah. So So I will be dealing mostly with, sometimes with gouty arthritis, but even at that, it's still not my forte. I will send them to Dr. Ima, but I'll be dealing mostly with osteoarthritis. And Dr. Ima, over to you. The rest.
Because you're talking about surgery. So Dr. Ima, you deal with majority of the others in terms of treatment. So how would you distinguish between them all? And what kind of things, so before we talk about surgical treatment, what kind of treatments would be offered? But first, how do you distinguish between them?
Okay, before I mention how we might distinguish between them, it's also important for me to note that we work very closely with our colleagues. I pretty much call ourselves brother and sister because it's very important that we work together. There are times when we have cases we have to quickly refer, and they have cases and we have to refer. So that's very important. There are times when we both have to even be involved in
managing
care of these patients.
Absolutely.
Yes. Yes. Now, having said that, there are different ways in which we differentiate them. And you already set the ball rolling, really. If it affects one joint, we have several, what I would call usual suspects. The medical term we use is differential diagnosis. But you know, when a crime is committed in a certain place, you would probably say, oh, there are usual suspects that are responsible. So if it's one joint, the usual suspects are sometimes the degenerative arthritis, septic arthritis, and gout, also with a few joints. If they affect the joints of the lower limbs, they're also usual as suspects as well. If they affect multiple joints, especially joints in the hands, then you begin to think of things that are inflammatory or autoimmune in nature. So that's the way we tend to differentiate them. Then we'll probably go on to talk about the treatment maybe after the break.
Okay. So we've talked about the breadth of it, but are there any kind of additional myths you want to bring up in terms of diagnosis?
Yes. While we're at it, I think a lot of different types of arthritis, a lot of doctors are unaware of their existence or the fact that they're common. You just see them as being things in the textbook. And that's because a lot of diagnoses being made are usually malaria and typhoid. And I think that masks a lot of diagnosis, because typically when you have a lot of arthritis tend to present with fever and joint pains, typically the symptoms you have with malaria. So I think the index of suspicion should arise if that same person keeps coming back within a short period of time recurrently. Then I think the index of suspicion, even the person having the pain should be able to say, you know what, I don't think it's malaria. I treated malaria.
I'm not getting better.
2 weeks ago.
Exactly.
I treated again 2 weeks again. And so at that point, within a space of 4 weeks to 6 weeks, you should be able to say, you know, this is not the typical malaria. I've had all kinds of treatments and it's not going. So I think I need to ask my doctor to refer me to someone who will probably find out what exactly is going on.
Okay. Thank you very much. Well, that was a very, very power-packed first session. One of the questions that has come through is it commoner in women or men?
Okay. Actually, in the literature, it's commoner in women. And factually, in my clinic, I tend to see more females than men. But then again, I think there are also mitigating factors to that. One of that is that I think women in our environment tend to be more, they tend to seek out healthcare a bit quicker than men. Men tend to kind of just try and keep things busy, trying to make money.
Trying to keep head
above
water.
But it is, yes, you know. So, but it's commoner in women.
And Dr.
But
Anetor,
it also does affect
Dr.
men.
Anetor, in your clinic, how do you see it? What do you see? People coming for surgery.
Yes, I think it's 2-to-1 so far in favor of women. But having said that, for rheumatoid arthritis in particular, there's a worldwide predilection towards women. So the ratio outnumber in 2-to-1 fashion. So yeah. But for the other arthritis, I'm not.
Yeah, even higher.
Okay, but what about gout? Don't men, how is gout? How common is gout in Nigeria? In fact, I'm very interested to know.
Yeah, gout is very common. Probably commoner than people think. Yeah, and men are actually the major what's the word? They're the ones who tend to have doubt more than women. So that's one of the few ones that the men took to themselves.
With gout clinic as well.
Yeah. So, Dr. Ima, talk to us about treatment, medical treatment, before we go on to talking to Dr. Tina about surgical treatment.
Okay, so in my mind, and I think the treatment begins once early diagnosis is made. So it's important. I believe that that's part of the treatment journey, ensuring that you get to a specialist on time and you begin to get the proper care on time, because that salvages a lot. Our neurology colleagues will say time is brain. The cardiologists will say time is heart, or time is muscle. I think for us, myself and Dr. Tina will say time is cartilage, probably, So, and I think that's a new one we have to coin. Time is joint, and I have numerous examples to buttress this. I've had people who, if they'd seen the right person or earlier, even though they did have arthritis, will not have become too serious. So that's why, for me, that is the number one starting point. Then in terms of treatment, with treatment, there are actually three major aspects of treatment. The common one everybody talks about is medication. So that's the pharmacological aspect. But we also talk about the non-pharmacological, that is things that don't require the intervention of a doctor per se, or rather the use of medication. Then you also have the surgical, and that's where Dr. Tina comes in. So I'll leave that
Now,
aspect to her.
under the sorry, the line somebody was calling through. Under the non-surgical or non-medical, that includes things like physiotherapy, doesn't it?
Yes,
I'd like to share my own, as it was, family history. My mother actually had her knee replaced at the age of 80. And it's very interesting that she had her knee replaced at 80. And she had two knees that were bothering her, but they said, do the one first. And amazingly, on rehabilitation of her new knee, the exercise she was doing for both knees, her second leg improved. So I think there's a lot to be said for some of the non-medical, non-surgical, i.e. the physiotherapy aspect of it, in terms of how, if people do the right things, they could perhaps improve things. So I'm really with you there, Dr. Ima. So talking to you, Dr. Tina, let's just go straight to the issue of surgery. Nigerians don't like having surgery.
Tell me about it.
So how does it work? They don't like surgery. In fact, people say, no, if you have surgery, that's how you'll be inside a wheelchair, that's how you will die. That's how, the stories are just so many. And sometimes people do need surgery, and they need it quite early. So what are the do's and don'ts? Who gets to go for surgery? And what age do you advise surgery to happen? Because some people, like, for example, I have a young lady. I mean, I call her young because she's not 40 yet. And she's overweight. She's got a bad knee, really in pain a lot. And they've told her to go for surgery. Would you want to operate on somebody that young? What are the do's and don'ts? Please tell us about it.
When it comes to the surgical management of arthritis, so that would be for end-stage arthritis. It's not one of those surgeries that you offer when things are still early. So, so you mentioned it's better to go early, not for arthritis. You shouldn't, the protocol is to not offer surgery unless it is end stage, what we call grade 4, that is bone on bone, because it is the end of the spectrum of your treatment. So we've been treating with analgesics, physical therapy. Physical therapy has its use not just after surgery. It's good to throw in exercise, throw in good physical therapy, because what you want is a holistic treatment so that when there is fitness, when you do need surgery, you are already fit and you are able to come through that tunnel in best shape. Your recovery is faster, you know, so physical therapy comes much early. And then thankfully, in this part of the world, the patients that present to you pretty late anyway.
Anyway, yes.
Because they've for years. They've used medications for years. They've been around. So by the time in my experience, they come to you in stage 4, bone on bone. So it is a question of allaying the fears, addressing the anxiety, because it is real. I mean, it is big deal. Arthroplasty surgery is a big deal, you know. So you begin to show what the patients will go through. You give them all the information, and you reassure them that it's going to be planned, safe surgery. You know,
Yeah,
what I do in my practice, I begin with showing. Go on, Pamela.
No, what I wanted to say was, Duchess Hospital already has a phenomenal reputation for surgery. Our vice president came and had surgery at the Duchess Hospital. So, you can't, obviously he wouldn't be doing that if he didn't think that was safe, which I think, is so commendable with so many people going abroad for surgery. The fact that he had his surgery in a Nigerian hospital, in your hospital, speaks volumes for the kind of caliber of care that is offered there. So I don't think, that should be in doubt. But, please carry on with what you were saying.
Yes.
Can I contribute a story here?
Of course.
If I may, So I had this patient, the aunt of a colleague, who my colleague got me to see this aunt of, and she had arthritis, bad arthritis, and we did the medications, asked her to do physical therapy, and even did the injections. But I said to her that, Mom, I even said to her, I said, Mommy, you need to have surgery. Now, here's where the kicker is. One of our sons is an orthopedic surgeon outside of Nigeria. She's refused, as the last time I know, to have surgery. Just say how real that fear is. I just want to contribute that.
Wow. No.
Yes.
I think it's something that
was speaking.
We cannot, overemphasize that issue and the fact that we have to overcome it. And it's real and something we need to respect and deal with. But unfortunately, you won't believe this. Yeah. We have 2 minutes to the end of the program. Time is already up. So I'm just going to be asking us to, so Tina, as you're speaking now, please just give your last words for our listeners.
Thank you very much. So arthritis is a real problem. Typically, when you have arthritis, especially in the lower limbs, it cascades into affecting your spine. It affects your gait. You're leaning to one side. Your back hurts. So the best thing to do is see the orthopedic surgeon. Go to a place you will trust and submit to safe surgery. I mean, it's okay to have, a second opinion, a third opinion. As far as you're getting safe, decent surgery, it will save you. It will save you. It will give you a better chance at a better quality of life in future. So that's the way to go.
Thank you. Dr. Ima, do you have any last words for our listeners?
Yes. Thank you very much, Dr. Pamela. I would say, make sure you present early. That's important, and to the right doctor, so that diagnosis is made.
Who is the right doctor?
I would say a rheumatologist and an orthopedic surgeon. Like I said, we work like Siamese twins, so we know we know who to go send to who. So that's to present to either both of us, or either of us rather. Then it's also important to realize that apart from the medications for pain, that there are all the non-pharmacological aspects are important. As a matter of fact, exercise is medicine. So that is very important. Joints that move tend to have more nutrition going to them that makes them healthier. So our sedentary lifestyle doesn't help, and we need to learn to move those joints. It's also important to reduce the weight that our joints carry. If you put too much weight than they've been designed to carry, they will buckle under that weight. So it's important to lose weight. Nutrition is important. A healthy lifestyle is important. So those are my last words with regards to.
And those are
the
in a
topic
nutshell what we need to do to stay active while managing arthritis. Thank you so much. Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.